Extract 1. Questions 1 to 12. You will hear a physiotherapist talking to Kelly, a woman with lower back pain. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
All right. Hi there, Kelly. My name is Erica and I'm one of the physiotherapists here.
Hi, Erica.
How can I help you today?
I've been getting a pain in my lower back on the left side, around my hip and through the bum cheek area, when I'm running especially.
Okay, that's not sounding terribly comfortable at all. How long has this been going on for?
It's something I've had on and off for years, and it started off as just a kind of dull pain, a bit of an ache, and now it really feels like it's spasming or something. It hurts even when I put weight on my left leg. Usually I feel it start, and if I kind of lie on a tennis ball and massage through the muscle, it goes away. But lately it's just been getting worse, and I can feel it sort of tight through my whole hip area. And I can feel it kind of even when I'm sitting and sleeping, or at night when I'm trying to sleep. If I roll, I can feel it kind of, it's hard to explain. It's like a shooting pain that travels down my leg.
Okay, so you described the pain initially as a dull pain,
Yeah.
and also an aching sort of a sensation.
Yep.
Is the shooting pain different to that?
Yep.
Okay, so the shooting pain, where does that go?
It starts in the same place, and it goes like down the back of my leg, kind of through the back of my knee, and sometimes down to my ankle area.
Okay, no worries at all. And that would be the shooting pain only? That's not an aching sensation?
No, it's just like, it feels like a twinge travelling down.
All right, so just coming back to our body chart for a second. So we've talked about two distinct pains, I think. There's that dull aching pain sort of around the bum and the lower back and the hip area there. Then there's that shooting pain or twinging pain that you get that goes right down the back of the left leg down to the calf.
Yep.
With the twinging pain, do you have to have the dull pain in your bum before you get the twinging pain?
Yep.
You have to have that pain
Yep.
first. Okay. Can you ever get the twinging pain by itself?
No.
No. Okay. Can you get the dull pain by itself?
Yeah.
Yes. Okay. So you have to have one to get two.
Yeah, I don't always get the twinging pain. That's usually when it's feeling worse. It gets really tight.
Okay, no worries at all. Now, just to confirm and clear some other areas, there's no current problems with your left knee?
Nope.
Beautiful. And currently the front of the left hip is fine?
Yeah, it feels quite tight through there, but it's not painful.
So tightness?
Yep.
No worries at all. Any pains in the right hip?
Nope.
No. The right knee?
No, the right side's fine.
Completely fine.
Yeah.
Good. No pains at all down there?
No.
Any pins and needles or numbness anywhere?
Nope.
No. Good.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Ndamukong. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning. Good morning. Please be seated. May I know your problem? Well, doctor, I have multiple issues with my teeth due to severe dental disease. I have had many of my teeth removed. Now I have severe tooth pain. Both lower and upper teeth on my left side have been troubling me for the past 3 days. Well, what's your age? 29, doctor. What medications are you taking? I'm taking OxyContin and Vicodin for my knee pain. I need more pain medications because I do not want to use that medicine for my toothache. Are you allergic to any medicine? Yes, penicillin and codeine. Do you drink or smoke? I do not drink, but I do smoke regularly. Well, your test reports show temperature 97.9, blood pressure is 146/83, pulse is 74, respiration 16, oxygen saturation 98% on room air, and interpreted as normal. Mouth and oropharynx shows multiple denture and multiple dental caries. You have tenderness to tooth 12 as well as tooth 21. Your gums are normal. There is no erythema or swelling. There is no purulent or other discharge noted. The floor of your mouth is normal without any abscess, suggestion of Ludwig's syndrome. You have developed odontologia and multiple dental caries. Well, I am prescribing Dilaudid of 4 milligrams intramuscular, and I would suggest you go for a filling. In this treatment, the affected area of the teeth will be drilled, and the decayed substance will be removed, and the empty space will be packed with an appropriate dental filling material. Okay, doctor. Thank you.
That is the end for Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the best answer, A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at the question 25. You hear a discussion between a nurse and a physician explaining about different types of breath sounds. Now read the question.
Hello, doctor. Can you explain what are the different types of breath sounds?
Well, there are several distinct types of abnormal breath sounds. Crackles, also called rails, tend to sound like discontinuous clicking. Bubbling or rattling when the person inhales, crackling breath sounds may sound dry or wet, and physicians might describe them as either coarse or fine. Stridor is a high-pitched, harsh, wheeze-like sound that occurs while breathing in people with a blocked upper airway. Wheezing noises are high-pitched and persistent that may sound like a breathy whistle. At times, wheezing can be loud enough to hear even without a stethoscope. A short version of a wheeze, called a squawk, occurs during inhalation. Ronchi are persistent, lower-pitched, rough sounds similar to snoring. Question 26. You hear a monologue by a physician explaining about Heberdine's nodes. Now read the question. The bony growths that develop on the finger joints are called Heberdine's nodes, or interphalangeal joints. Mostly, Heberdine's nodes develop on the joints nearest to the fingertips, causing the fingers to appear crooked. They only develop in osteoarthritis patients. Each joint in our body has a layer of cartilage to protect the bones. Osteoarthritis causes the cartilage layer to degrade, gradually allowing the bones in the joints contact directly with each other. Over time, the bones get damaged from scraping together. Our body reacts to this body damage by developing new bones that are known as nodes. Heberdine's nodes are one of such bone formations on the fingers of patients with severe osteoarthritis. Question 27. You hear a discussion between a nurse and a physician explaining about surgical treatments for patients with a desiccated disc. Now read the question.
Hello, doctor. What are the surgical treatments for patients with a desiccated disc?
There are many different surgical treatments for a desiccated disc. In the method called fusion, the vertebrae surrounding the desiccated disc will be joined together to stabilize the back and prevent movement that will worsen pain, causing discomfort. In the decompression method, the extra bone or a disc material that has moved out of place is removed to make more room for the spinal nerves. In the correction method, the surgeon will make the necessary repairs to correct an abnormal curvature of the spine to relieve pain and increase range of motion. In the implant method, artificial discs, or spacers, will be placed in between vertebrae to prevent the bones from rubbing. Question 28. You hear a discussion between a nurse and a physician explaining about outcomes of TB skin test. Now read the question.
Doctor, can you explain to me the outcomes of a TB skin test?
Well, the outcomes for TB skin tests are not always clear-cut. The main consideration in a TB test is the size of the bump on the arm. If the bump is smaller than 5 millimeters, then the test result is considered negative to TB. In a case where the test bump is larger than 5 millimeters, then the test result is considered positive. But we have to be very cautious about false positive and false negative. At times, patients vaccinated against TB using the Bacillus calmette-guerin can show a false positive result for TB. There is also a possibility that when the patient's infected with bacteria similar to TB, false negative result happens when a person has a weak immune system or has been exposed to pathogens, such as smallpox or measles. Patients infected with TB very recently and very old TB patients can also show false negative test results. You hear a monologue by a physician explaining about atelectasis. Now read the question. A partial or complete collapse of one or both the lungs is called atelectasis. That occurs when tiny air sacs in the lungs, called alveoli, deflate. The collapse of the lowest lobes in both the lungs is called bibasilar atelectasis. The lobes of the lungs are filled with millions of tiny sacs, called alveoli, which are arranged in clusters and surrounded by blood vessels. When a person breathes, the alveoli allow their blood to collect oxygen and exhale carbon dioxide. During bibasilar atelectasis, the alveoli in the lower lobes of the lungs deflate and stop performing this crucial task, therefore blocking oxygen from reaching the vital organs, life-threatening at times. Question 30. You hear a discussion between a nurse and a physician explaining about liver flukes. Now read the question.
Doctor, what are liver flukes?
Liver flukes is a parasite disease. A patient may never know he has liver flukes. Even the doctors at times may not diagnose the condition because the symptoms of fascioliasis are similar to many other conditions. There are chances that a person with liver flukes living may never develop fasciolaceus. Others may develop fasciolaceus many years after the liver flukes entered the body. A person cannot transmit liver flukes accidentally to someone else, unlike other parasite diseases. Liver flukes make their way from the intestines to the liver once it enters the body. To get into the liver flukes must burrow through the lining of the liver, causing pain in the upper right abdomen. The two types of liver flukes that can affect people are fasciola hepatica and fasciola gigantica.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear the discussion between a senior doctor and junior doctors about bone marrow transplant procedures. You have 90 seconds to read questions 31 to 36. Hello, doctor. Can you kindly explain bone marrow transplant procedures?
Well, bone marrow consists of precursor or predecessor immature cells called stem cells. These are primitive cells that are capable of producing all types of cells. Blood cells like red blood cells, white blood cells, and platelets start out from young cells called hematopoietic stem cells. Stem cells mostly live in the bone marrow where they divide and make new blood cells. These cells mature into adult cells and then leave the marrow into the bloodstream. A small amount of stem cells also get into the bloodstream, which are called peripheral blood stem cells. When the bone marrow has been destroyed by disease, chemotherapy, or radiation, the stem cells may be transplanted and restored. Depending on the source of the stem cells, this procedure may be called either bone marrow transplant, or peripheral blood stem cell transplant, or cord blood transplant. These three types are called hematopoietic stem cell transplant. There are three possible sources of stem cells to use for transplants, which includes bone marrow, the bloodstream or peripheral blood, umbilical cord blood from newborns. The first successful bone marrow transplant was done in 1968. After nearly 2 decades, stem cells taken from peripheral blood were transplanted with success. More recently, doctors have started using cord blood from the placenta and umbilical cords of newborn babies as another source of stem cells. Today, nearly 50,000 new transplants are done each year.
Well, doctor, when is a bone marrow transplant required?
Stem cell transplants are used to replace bone marrow that's been destroyed by diseases such as leukemia, aplastic anemia, certain inherited blood, exposure to cancer chemotherapy, cancer radiation therapy, some diseases of the immune system. In these conditions, the stem cells become incapable to make adequate blood cells. Therefore, a stem cell transplant may help correct these problems. In certain types of cancers, such as certain leukemias, multiple myeloma, and some lymphomas, a stem cell transplant can be an essential part of treatment. For these patients, high doses of chemotherapy or radiation therapy, although a good option, the procedure causes bone marrow suppression. Therefore, once high doses are used, a stem cell transplant is made to replenish the suppressed marrow. Different types of bone marrow transplant include autologous transplant, cells come from the patient's own bone marrow, allogeneic transplant, the cells come from a matched related or unrelated donor, syngeneic transplant, the cells are derived from an identical twin. Autologous stem cell transplant, in this type the patient's own bone marrow cells are taken prior to the anti-cancer procedure, and these stem cells are harvested from either bone marrow or blood and then frozen. The advantage is that the patients get their own blood cells, and thus there is a decreased risk of the immune system not recognizing the cells and rejecting them, or mounting an attack on them, which is called graft rejection, and rejection makes allogeneic transplants difficult. The disadvantage of this process is the risk of the originally taken stem cells carrying cancer cells that are reintroduced in the body. This may bring the cancer back. Normally, autologous stem cell transplant is mainly used to treat certain leukemias with lymphomas and multiple myeloma. At times, it is also used for other types of cancers, especially in children. In a tandem transplant, a patient gets 2 courses of high-dose chemo, each followed by a transplant of their own stem cells. All of the stem cells needed are collected before the first high-dose chemo treatment, and half of them are used for each procedure. Allogeneic stem cell transplant. In this type, the stem cells do not come from the patient, but from a donor whose tissue type is matched with the patient. Usually, the donor is a family member or sibling of the patient. The donor may be sought from a national registry as well. This may be called a matched unrelated donor transplant. Cord blood transplant is another procedure where blood is taken from the placenta and umbilical cord of newborns. This blood has a high number of stem cells, but the number of stem cells in a unit of cord blood is often too low for large adults, so this source of stem cells has so far been used more in children. The advantage of allogenic transplant is that the donor stem cells make their own immune cells, which may help destroy any cancer cells in the patient. The disadvantage is the risk of graft rejection that may require lifelong use of immunity-suppressing agents. Allogeneic transplant is most often used to treat certain types of leukemia, lymphomas, and other bone marrow disorders such as myelodysplasia. A number of factors play a role in how the immune system knows the difference between self and non-self. The most important factor that is used in allogenic transplants is called human leukocyte antigen system. Human leukocyte antigens are proteins found on the surface of most cells. Each person has a number of pairs of human leukocyte antigens. They inherit one of each of these antigens from each of their parents. Physicians try to match these antigens when finding a donor for patient person getting a stem cell transplant. Syngeneic stem cell transplant is possible only between identical twins or triplets with similar genetic makeup. An advantage of syngeneic stem cell transplant is that graft versus host disease will not be a problem. There are no cancer cells in the transplant.
Now look at extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on scleroderma. You have 90 seconds to read questions 37 to 42.
Hello, doctor. Could you please explain different types of scleroderma?
Well, scleroderma is a symptom of a complicated group of diseases by an abnormal growth of connected tissue that supports the skin and internal organs. This disease is also termed as systemic sclerosis. Scleroderma literally means hard skin, derived from the Greek words sclerosis, meaning hard, and derma, meaning skin. Scleroderma is considered both rheumatic disease, since the conditions are characterized by inflammation and pain in the muscles, fibrous tissues or joints, and a connective tissue disease. Certain types of scleroderma have a limited abnormal process that primarily makes the skin hard and tight. Other types are more complicated, affecting the internal organs, such as the lungs, heart, and kidneys, and the blood vessels. A phrase identified as softening occurs, during which less collagen is produced. There are two main classifications of scleroderma. Localized scleroderma, that affects only certain parts of the body, that includes linear scleroderma and morphea, and systemic sclerosis, that affects the entire body. Localized scleroderma. Localized scleroderma affects the skin and related tissues, and, at times, the muscles below. However, internal organs are not affected. Localized scleroderma can never advance to the systemic type. Moreover, localized types can improve over time. However, the skin changes that occur during the disease can be permanent. It may be serious and disabling. Morphea. Reddish patches of skin that thickens into firm oval-shaped areas are distinctive characteristics of the morphea type. The centers of the patches appear ivory with violet borders. The patches occur on the stomach, chest, face, back, legs, and arms. Typically, these patches sweat a little and have little hair growth on it. Morphea can limit to one or several patches, ranging from ½ inch to 12 inches in diameter, or else it can be hard and dark, spreading over larger areas of the body. Morphea generally fades out in about 5 years. However, people can have permanent dark skin patches and muscle weakness. Linear scleroderma, characterized by a distinctive single line or band of thickened, abnormally colored skin. Typically, the line runs down an arm or leg and can run down the forehead. Systemic sclerosis not only affects skin but also involves blood vessels and major organs. Patients with systemic sclerosis often have all of the following symptoms, known as Kress syndrome, an acronym for calcinosis, formation of calcium deposits in the connective tissue. Raynaud's phenomenon. Small blood vessels of hands or feet contract in response to cold or anxiety. Esophageal dysfunction. Impaired function of the esophagus occurs when smooth muscles in the esophagus lose normal movement. Sclerodactyly. Thick and tight skin on fingers result from deposits of excessive collagen within skin layers. Cholangiotaceous. Small red spots on the hands and face are caused by swelling of tiny blood vessels. Systemic sclerosis is further divided into two categories, called limited and diffuse. Typically, limited scleroderma has a gradual onset and is restricted to certain parts of the skin, such as hands, fingers, lower arms, face, and legs. Often, Raynaud's phenomenon is experienced for years before skin thickening becomes evident. Calcinosis and cholangiotaceous often follow. At times, limited scleroderma is referred to as Kress syndrome because of the predominance of Kress symptoms in these patients. Typically, diffuse scleroderma has a sudden onset. Skin thickening develops quickly and covers much of the body in a symmetric pattern. Most of the internal organs can be damaged. Skin can swell, appear shiny, and feel itchy and tight. The damage of diffuse scleroderma occurs over a period of a few years. After a period of 3 to 5 years, patients tend to stabilize, a phase when progression of the disease seems little and symptoms subside, but gradually. Skin changes begin again. A phase identified as softening occurs, during which less collagen is produced and the body rids of excess collagen by itself. This is the end of Part C. You now have 2 minutes to check your answers.